The CAPRI-GOIM is a phase 2 academic randomized trial who suggested the role of maintaining the anti-EGF receptor inhibition with FOLFOX after a failure of FOLFIRI plus cetuximab in patients with metastatic colorectal cancer, in patients that were molecularly selected by NGS, which is a new technique. Now we have made a post-hoc analysis on elderly population because we want to assess the efficacy and the safety in this setting. So we performed this post-hoc analysis. We decided to choose 3 cutoffs to define the elderly population. We had a cutoff in which patients were selected and were aged less than 65 years old, a population in which the cutoff was more than 70 years old, and the third in which the population was more than 75 years old. We randomized 340 patients and we performed the NGS analysis on 182 tumors. So we had a population that we called intention to treat analysis of 340 patients, and the NGS cohort in which we performed the NGS analysis on 182 patients. And finally, we have also another population that we call the quadruple positive tumors, in which no mutation were found in KRAS, NRAS, BRAF, and PI3 kinase genes. So we analyzed the safety, and we analyzed also the efficacy by considering the PFS of the patient and the overall response rate. And we found that there was no major difference between the group that we selected according to age. So the PFS and the overall response rate were similar in the patient with the age below 65, in patient more than 70 and patient more than 75. We found some difference in the safety, because in patients with more than 75 years old, we found high incidence of diarrhea grade 3 and of neutropenia. And in young population, in patients that were defined less than 70 years old, we found much more asthenia. But in conclusion, we can say that FOLFIRI plus cetuximab is safe and is tolerated in patients that we define elderly.